My name is Laura Serbu. I'm an internal medicine physician and a preventive medicine physician. We'll be talking about avian flu today, also known as bird flu, but just to make it easier, I'll just be saying bird flu moving forward. The outline for this talk is answering these questions. What is bird flu and how does it compare to regular flu? Who is getting bird flu? How to prevent bird flu? And how concerned should we be? So first things first, I think it's important to talk about regular flu. The flu is a virus that can spread from person to person, and the typical symptoms include cough, runny nose, headache, fever, fatigue, feeling tired, body aches, sneezing sometimes too. It's similar to a lot of different viruses that are out there, but for many people it can feel more intense, especially with the tiredness and especially with some body aches as well. The bird flu is also a virus, but this virus is typically for birds and different animals. I've never seen a bird sneeze, but birds also have phlegm and mucus and secretions basically, and those allow viruses to spread amongst themselves too. Bird flu can even be for chickens, it can be for different birds, and because birds fly, or a lot of birds fly, it can be spread pretty quickly in large areas as well. And what we know about most bird flus is that they don't tend to go from bird to human. However, the virus can spread to other animals, including cats and cows. So you might have heard of bird flu infecting cattle herds or cows. And so this virus typically stays amongst animals. I think we should talk about something that I just made up the phrase for, the flu scramble. Essentially, the flu virus can mix up itself with other flu viruses and basically create a new version of itself. For example, the virus on the left has these blue long spikes and the flu virus on the right has red rounded spikes. But if these two flu viruses were to scramble, we would get a new one that is a different color, is green in this case, and also is a little more rounded spikes, but a little bit shorter. It can recreate itself. And this is part of the reason why every year we have a new flu vaccine, because the way the flu vaccine is made is basically trying to identify, for example, these spikes on the side. But if every year those spikes look a little different, then the vaccine also has to change to target those spikes. So this relates to why sometimes the bird flu can be seen in humans. So one bird flu scrambled with another bird flu, created a different variation of the bird flu that can spread from bird to bird and can also spread from bird to human. However, most of the bird flus that we've seen so far don't spread from human to human. It's not able to just based on the current version. And so that's why it's been in the news, bird flu, now a version of it going into humans, but it hasn't been spreading from human to human. Who is getting bird flu? Typically, the people getting bird flu include poultry farmers, dairy farmers, and also people with chicken or birds in their backyard. So people who are exposed to birds and chickens and animals, those are the ones who have been getting sick with bird flu. You might be thinking, how do I prevent bird flu? I don't want to get bird flu. The main risk for getting bird flu, as I mentioned, is contact with birds. So to prevent bird flu, it's important to prevent contact with birds, including while traveling. This is important because in other countries, less so in the US, there may be markets selling food. Some of those markets might have live birds for sale, and that is a place where if any of those birds were sick, it could be transmitted to a human. I looked this up for myself because I was thinking, there are a lot of pigeons in New York. Does that mean I'm at risk for getting bird flu from a pigeon? Fortunately, the version of the bird flus that we're seeing, pigeons aren't really getting it. So that's a positive. That's a good thing. It's important to cook eggs and meat fully and typically to 165 degrees or more. It's important also to avoid drinking raw or unpasteurized milk. Pasteurized milk is treated in such a way that viruses are killed in the milk, so there's no risk for getting bird flu from pasteurized milk. And typical flu prevention, when we're trying to just prevent regular flu for humans, applies here as well. Make sure to wash hands often, avoid touching the face, and stay at home if feeling unwell, and avoid contact with others if they are sick. How concerned should we be? So on the top here is New York State and the United States for bird flu, regular flu, and COVID. So far, with bird flu, there have been 0 cases of bird flu that we know of in New York State, and there have been 66 most cases of bird flu in the United States. Unfortunately, one person did pass away from bird flu, but as far as I know, everyone else has survived the illness. I think all of these people had exposure to birds, mainly by being on a chicken farm or on a cow farm, or they had birds in their backyard. Now, for regular flu, however, in New York State, in a typical season, so several months out of the year, 400,000 people can be getting regular flu. And across the US, that number for even just a couple months, October to December of last year, about 7 million people got regular flu, which is a whole lot of people. And for COVID, this number is a little trickier to find nowadays as we have less COVID data available to the public. But in a typical day, maybe about 1,000 to 1,600 people could get COVID. And just over a couple months last year, it's estimated like 3.6 got COVID as well. That's a whole lot of numbers, but basically very few cases of bird flu, a whole lot more cases of regular flu and COVID, as you can see, in the millions, even nationally. To summarize, how concerned should we be? For bird flu, low concern at this time. For regular flu, a little bit more concern. We're in flu season. It's no fun getting the flu, and people do unfortunately die from the flu. And similar with COVID, COVID cases are going up. As you know, they go up and down, and it's more likely to get COVID than bird flu. I just wanted to briefly put in a recommendation that there's still time to get a flu shot. It's not too late. These are the number of flu cases in New York State. On the bottom here are different weeks of the year, going from the beginning of October to the middle of May. The numbers on the left here are the number of cases. So it goes from 10,000 cases a week up to 60,000 cases a week. And the different colors are the different years. So blue is the 2021 season, brown 2022 to 23, green 23 to 24, and last but not least, red, the season that we are currently in, 24 to 25. At the beginning of December, the line was all the way here at the bottom, like 5,000 cases a week of flu. But as you can see, this red line is going up. We have not yet reached the peak point of flu season. We are in the middle of flu season right now, the intense part of flu season. We don't know yet when the number of cases will be going down. This past week or so, there were about 30,000 people who were diagnosed with the flu in New York State alone, which was reported to the Department of Health. But all to say, there's definitely still time to get a flu shot. Just wanted to reiterate, how concerned should we be about bird flu? It's low concern at this time. However, no one knows what the future holds for any of us, and that includes not knowing what version of bird flu can be in the future as well. Because the current versions that we have don't spread from human to human, the concern would go up if someone got sick with bird flu and regular flu at the same time, which would be really unfortunate, and that person would probably not be feeling very well. But that gives the opportunity for the bird flu and the regular flu to scramble amongst themselves and create a new version of the bird flu virus that may be able to go from a sick person to another sick person. And that's when we would be more concerned and would probably try to start measures to prevent spread from human to human. Around the world since 2003, there have been 950 cases of bird flu reported to the World Health Organization. Unfortunately, of those 950 cases, there were 464 deaths. There may have been more bird flu cases than reported to the WHO. Certainly, the level of medical care around the world is very different. And I just wanted to share that to say that even though there are only 66 cases in the US, there have been bird flu cases in different parts of the world, but those numbers are still pretty low. And this has been since 2003. I just wanted to end with our typical slides here about long COVID. Some people who have COVID may experience long-term conditions or symptoms that continue or develop after the infection. This is known as long COVID. People are most at risk who did not receive a COVID vaccine, who have experienced more severe COVID illness or were even hospitalized for it, and people who have prior underlying health conditions. There are some common symptoms, including coughing or breathing problems, loss or smell, body aches, headaches, trouble sleeping, brain fog, tiredness, fever. There have been over 200 symptoms connected to long COVID thus far. And if you think that you may have long COVID, there's unfortunately no test for it at this time, but speaking to your healthcare provider can be the starting point for being connected to care. And you can also scan this QR code on the right. Last but not least, speaking about staying up to date on vaccines, I mentioned the flu shot earlier. COVID vaccine has been available now for several months, recommended for everyone over 6 months of age and older. And if you haven't yet gotten vaccinated, there's the usual 2-dose series for Moderna or 3-dose series for Pfizer. RSV, there's a shot available for people over age 60 and also can apply for people who are pregnant. And lastly, pneumonia. If you're an adult aged over 65, it's just 1 dose for that. But also if someone is aged 19 to 64, they may be eligible for the pneumonia vaccine if they have certain chronic medical conditions. To end and summarize, I thought I would just answer the questions that I set up at the beginning for the outline. So what is bird flu? Flu that has mainly spread between birds. Rarely humans get it too. Who is getting bird flu? Farmers or people in contact with birds. How to prevent bird flu? At this point in time, mainly preventing contact with birds, but certainly the precautions for flu can prevent us just from getting sick in general. And how concerned should we be? Fortunately, low concern at this time. There have been since 2003, maybe even before then, instances of bird flu spreading from birds to humans, and that's why there's been bigger outbreaks in different countries around the world, including the US at times, between 2009 and other times. This variant that we're seeing, and there are many variants even currently at large, but the variant or the variants that are wreaking havoc at this time are related to the ones affecting birds. And then when there's a bird or two or a chicken or two that gets sick, they have to kill the entire flock. And so that's why egg prices have been going up, because we have less chickens laying eggs. At this time, what we're mainly seeing is amongst birds and birds to human. In the past, there has been some human to human spread.
And one of the reasons that we're at low concern right now is because that's not what we're seeing this time. Do we know how long bird flu lasts in humans when they get it?
My understanding is that it's a similar timeline to regular flu. There's a phrase related to infections called an incubation period, where someone is exposed to a virus and then they don't really have symptoms and then they have symptoms. So for regular flu, that period is like 2 days or so. For bird flu, I think that could be a little bit longer. The symptoms could probably last anywhere from 5 days to 2 weeks. But as like with any infection, there's quite a range. People can have it for a handful of days. Some people can feel kind of crappy for longer. Some of the medications that we use for regular flu are okay to use in bird flu and have been shown to be helpful, essentially, since they're similar viruses but different strains of the flu virus. So antivirus medications can be helpful. Unfortunately, antibiotics that are against bacteria are not helpful in this case.